Hello students, this is Dr. Ways and welcome to your lecture on the pelvic floor. In order to start talking about the pelvic floor, we need to have an understanding of what the actual pelvis is. So we kind of lumped the pelvis together in with the abdominal cavity in previous lectures, but the pelvis can be divided into two separate regions. One that's generally considered the part of the abdominal cavity, which we already covered, and that is called the false pelvis, and that kind of runs from the iliac crest all the way around this area, right? And everything that's I'm coloring in green right here would be the false pelvis, and you know the organs that we've talked about kind of sit in that area for the most part. The true pelvis actually lies below this line, which we call the pelvic inlet. All right, so the true pelvis lies right here with the sacrum being the back wall and the pubic symphysis being the front anterior wall, and then the pelvic floor, of course, at the bottom would be the inferior wall of the true pelvis. So in addition to realizing the difference between those, it's good to know a couple of the anatomy of the bone, so make sure you particularly pay attention to this when you get into lab and you are looking at the bones and be able to identify these structures. So we already mentioned that we have the iliac crest right here. All right, so that would make this bone the ilium. All right, here would be the pubis, and in back we would have the ischium. All right, specific parts of the ilium that we need to be familiar with right now: the anterior superior iliac spine, which you'll often see abbreviated as ASIS, and you can actually feel that on yourselves if you find your your iliac crest and follow them all the way to the front where they come to a point. That's your ASIS right there. And if you remember from previous lectures, that's the spot from which the inguinal ligament will go from to the pubic symphysis. And the posterior border on the ischium, we'll have this ischial spine, which we can see right here. Of course, you have the coccyx. This is your sacrum, and this is the body of the sacrum, which will stack underneath the last lumbar vertebrae. And we have the obturator foramens right here, and we'll be talking about what those are and how they work within the pelvis a little bit later on. So here we're looking at one half of the pelvis. This is the whole sacrum and the coccyx right here, and here would be the whole pelvic bone for the right side. So what you're missing is the left side here. And here is your pelvic inlet right here with this red dotted line. And so your walls would be contained within this region between the pubis and the sacrum right here, and the lateral bony walls of the pelvis, part of the ischium, or ilium and ischium rather, right here. And so notice the ligaments here that are tying the sacrum and the coccyx to the ischium right here. You don't need to know what those ligaments are, but be aware that there are ligaments there holding them together. They don't just sit freely. And then we're going to go over here and look at the muscles that are going to form the lateral portion of the pelvic wall. So first of all, we have our obturator internus muscle. So if we look at this, this is kind of a fan-shaped muscle that's covering the obturator foramen. All right, covering the obturator foramen. And then just superior to that, we will have the piriformis muscle. All right, notice the piriformis muscle is going from the ilium, the pelvic inlet here, to the sacrum back here. And both of these are going to form the lateral portion of the pelvic wall. And also notice that both of these are below the level of the pelvic inlet. So again, we're strictly talking about the true pelvis here. From the inferior view of the pelvis, we see this, and I'll do it in green as well, the outline of the hole, if you will, that's at the bottom of the pelvis, or the inferior portion of the pelvis, called the pelvic outlet. So from the superior surface, it's a pelvic inlet. From the inferior surface, it's a pelvic outlet. All right, and so you notice the borders of that are the ischiopubal rami, the ligaments that are holding the sacrum and coccyx to the ischium, as well as the coccyx itself and the pubic symphysis. So those will be the borders of the pelvic outlet. So when we talk about the pelvic floor, we're talking about the muscles and specifically the membrane that makes up the pelvic floor. So we've already mentioned the obturator internus muscle and the piriformis muscle forming the lateral wall. But then we have other muscles that are going to add to that. So a brief overview here, we have the coccygeus muscle, and we see that on either side. So this is your sacrum, here's your coccyx. This would be, again, the right portion of your coxal bone, and here would be the pubic region right here. All right. Deep to that, or more superficial to the inside of the pelvic cavity, we have the levator ani muscle. And you notice that the levator ani muscle is made up of 3 separate muscles. And the names of the muscles tell you where they go. So the iliococcygeus goes from the ilium to the coccyx. The pubococcygeus goes from the pubis to the coccyx. And the puborectalis, right here, goes from the pubis to the rectum. And notice that the puborectalis actually surrounds the rectum. It doesn't just go to it, it actually surrounds the entire potential space of where the rectum is going to be. Inferior to the levator ani muscles, we will have the perineal membrane, which is this gray area right here, and then the muscles within the deep perineal pouch, and that's going to support the levator ani muscles both anteriorly and inferiorly. And notice that within that we have a hole for the vaginal orifice if this is going to be a female, or if it's a male, there's going to be a hole for the urethral orifice, as you see in the female as well. All right, so this is another one of those slides that I have to apologize for because we are missing the male anatomy over here, but the same concepts are going to apply. So make sure that you are in your PowerPoint taking the notes and drawing the same structures there as well. So what we want to point out here with the perineum is that we have the pelvic or perineal membrane right here. So here's a perineal membrane, and then just on the other side of that would be your deep perineal pouch with the muscles in it. All right, and then we have our reproductive structures that are anchored to the pelvic bones right here in the female. Of course, that would be the erectile tissues of the female clitoris. And then just on the other side of that, we will have our levator ani muscles, which will be all of these that take, you can see right here, as well as the anal aperture, which is the hole for the anus. Aperture means hole, of course. And the external anal sphincter right here, which is that voluntary sphincter that allows us to hold the contents of the rectum inside until we're ready to defecate. To make this easier to understand and to look at, this region is often divided into triangles. So in the posterior portion, towards the sacrum, we have what we've referred to as the anal triangle. All right, the anal triangle, which contains one half of the anus, the anterior border being the perineal membrane, and the lateral border being the ligament between the sacrum and coccyx and the ischium, and then the superior border being, of course, the levator ani muscles. All right, so you'll have two anal triangles, one on the left side and one on the right side. So I'll draw both of them in right here. And then anteriorly, you have what we call the urogenital triangle. So the urogenital triangle is divided very similarly, right up the middle, and you can do this in the male and the female, bisecting the vaginal orifice as well as the urethral orifice. The anterior border, of course, being the pubic bone right here, the inferior border of the pubic bone, all the way to the ischium right here. And then, of course, the posterior border would be the same as the anterior border of the anal triangle, which would be the where the perineal membrane comes to an end. And then the superior border, of course, would be the perineal membrane itself. And again, the only difference between the female and the male in terms of these triangles would be in the urogenital triangle, where you would have female reproductive organs versus male reproductive organs here. So a little bit more about the pelvic wall muscles, and of course this would be the piriformis muscle, as well as the obturator internus muscle. So I don't care that you know the origin and insertion of these, but I do want to point them out because the origins are going to be attached to either the sacrum or the hip bones, the coxal bones, but the insertions, notice that they are going to the greater trochanter of the femur. All right, and if they're going to the greater trochanter of the femur, that means that they are going to move the femur proximally. All right, so what that means functionally is that it's going to be involved in moving your hip. And so the type of movements we'll see will be lateral rotation. All right, so lateral rotation would be rotating outwards away from your body as opposed to inward. And as well as abduction of the flexed hip. So if you bring your, if you flex your hip, bring your knees up, towards your chest, and contract that muscle, it will allow you to abduct your hip away from your body. All right, and that has to do with the angle at which the piriformis as well as the obturator internus muscle are in relation to the muscle. So the bone. So in lab, we can demonstrate how that works and what that might look like. All right, so the pelvic floor muscles, which we can also term the pelvic diaphragm muscles. Remember, all these muscles are attached from bone to bone, okay? And these bones don't really move that much, so the role that they play, except when we're talking about the puborectalis muscle, the role that they are going to play is to, one, support the pelvic viscera, so all of the organs that are in there, they will be able to support those organs. Maintain an angle between the rectum and anal canal, which forms like a sling around the rectum, which helps with continence. In other words, keeping our fecal matter within the rectum until we are ready to defecate. And so to that end, it will also help reinforce the external anal sphincter, because remember, the external anal sphincter is just on the other side of that, and we have voluntary control of that. So if we have our rectum in a sling and we are clamping down on that external anal sphincter, then we are really, holding it in or maintaining our continence. All right, and in women, it functions as a vaginal sphincter. So down here we would have the vaginal canal, and these levator ani muscles can squeeze around that canal as well, and the urethra. So taken together, it controls our helps control defecation response, sexual response, as well as urination response. Then, of course, in males, it would be the urinary and defecation responses. Just superficial to the levator ani muscles, we have our perineal membrane. And we've talked about the perineal membrane thus far as being associated with these structures, but what it is specifically is a triangular shaped piece of tough fibrous tissue that sits below the pelvic floor and acts as a supporting structure between the arms of the pubic arch. And so if this is an inferior view of the pelvis, and this right here is a pubic arch, where this being a pubic symphysis, I'm not very good at drawing, so I don't have the picture here to refer to, so I had to draw. And this is the urogenital triangle. It would fill this space. The perineal membrane would fill that space, forming the basis for the urogenital triangle. Just deep to that perineal membrane, you have what is called here the deep perineal pouch. All right, and right now it looks like it's empty space, but it is filled with different muscles that will help contribute to the functions of the pelvic floor muscles. And again, this is lying just superficial to the pelvic floor muscles, in between those muscles and the perineal membrane. So within that deep perineal pouch, you will have the external urethral sphincter. All right, and that's going to be round, and it's around the sphincter, so that's going to take place. And remember, anything that's an external sphincter is under voluntary control, so that will help, with continence. We have deep transverse perineal muscles. Notice they're going in a transverse direction from side to side. And part of their job is to stabilize the position of the perineal body, and the perineal body would be back here, and we'll talk about that in the next slide. They will also help stabilize all the structures within the deep perineal pouch. So this picture kind of gives you a false impression of what the deep transverse perineal muscles are. It's this entire sheet, which is a deep transverse perineal muscle. So not only are they supporting the perineal pouch, but they're also supporting the opening for the vagina in females, and the opening for the urethra in both males and females. All right, and then there's a difference between males and females in a couple of muscles that are specifically only in females. One is the compressor urethrae, so that would be right here, the compressor urethrae. And if you look at it, when that contracts, that's going to pull the urethra this way and compress it, kind of like we talked about that concept of the rectum being in a sling of muscle. This would be a sling of muscle for the female urethra, supporting the function of the external urethral sphincter. The other muscle that's you'll have in females is directly surrounding the vagina or vaginal canal, as well as part of the urethra, and that's called the sphincter uretrovaginalis. And of course, you notice that it also functions as an accessory sphincter of the urethra, so supporting the external urethral sphincter as well as the compressor urethrae. Since it circles the vagina, it can also help in closing the vagina, because throughout normal everyday activities, the vagina remains in a partially closed position. And so part of what helps maintain that partially closed position would be this sphincter uretrovaginalis. And then on the posterior border of the perineal membrane, we have this triangular shaped piece of tissue, fibrous connective tissue, known as the perineal body. And notice that it goes from the posterior border of the perineal membrane to the anterior border of the opening for the rectum. So here's another view of it, and if you look at its location, it serves as more of its function is more of a site where all of the many of the muscles of the pelvic floor can attach to and have something to pull against. So when the muscles pull, they'll often pull on this perineal body, which pulls on the perineal membrane and causes that upward motion of the pelvic floor. But also of clinical relevance, if a female is giving birth and she's having trouble with a vaginal delivery, often what they'll do is they will cut that perineal body to facilitate the movement of the baby's head through the vaginal canal. And that cut through the perineal body is called an episiotomy. And I got to witness one of these when my son was born. All right, so now that we know what the pelvic floor looks like and the pelvic walls look like and what makes them up, let's put some organs in place and kind of show where they are in relation to the pelvic floor and to each other. So starting with the male, we're going to use this perineal membrane and deep perineal pouch as our a landmark. And remember that sits just superficial, just inferior to the muscles of the pelvic floor. And you notice, and so remember there is an opening in that perineal membrane for the urethra. So we talked about the male urethra before, and it is surrounded on the inside of the perineal membrane by the prostate gland. All right, and then just superior to that, you're going to have the urinary bladder. So urine will flow from the bladder through the prostatic urethra, through the perineal membrane, and through the rest of the parts of the urethra as it goes to the outside of the body. And so notice also that the bladder and the prostate are oriented towards the anterior border of the pelvic cavity. All right, for females, again, here's the perineal membrane and the deep perineal pouch just deep to that. Here is the urinary bladder, and as it is going through the perineal membrane, here's the urethra, and there's the outside, and here would be the external urethral opening. Some more perineal membrane, the opening for the vaginal canal, and then heading backwards until it becomes continuous with the pelvic floor muscles, or the levator ani muscles. All right, so a key thing to remember here is that the perineal membrane is only going to house the urethra and the vaginal canal in females, and only the urethra in males. All right, remember the rectal canal is within the levator ani muscles, and we'll talk about that as we move along. All right, two more things I want to mention about this picture is we talked about organ placement. So the vaginal canal is going up towards the cervix of the uterus, and notice that the uterus folds back anteriorly and sits on top of the urinary bladder. And just like the male, the urinary bladder is placed in the anterior of the pelvic cavity. All right, so that leaves room posteriorly for the rectum. Secondly, I want to point out here that in both the male and female, the external urethral sphincter is within the deep perineal pouch. And in the males, we saw the internal urethral sphincter. Let me erase something here. We saw the internal urethral sphincter here between the urinary bladder and the prostate. And part of its function there is not only to allow urine to exit the bladder into the urethra, but during ejaculation, it also prevents backflow of semen into the urinary bladder. So that's completely clamped shut during ejaculatory conditions. All right, in females, we don't really have a proper internal urethral sphincter. It is considered functionally part of the dartos muscle that surrounds the entire urinary bladder. So it's more of a functional concept rather than an actual discrete muscle that we're going to find within the female urinary system. All right, so something to keep in mind. And then one more thing I want to mention is just for you to notice here in the levator ani muscle, there's that hole for the rectum, and here is that angle that we talked about. So the rectum is at a right angle to the anus, and that sling effect is kind of what is part of what helps us maintain fecal continence. And so this is a good picture that shows that angle, as well as how the puborectalis muscle creates the sling. All right, so speaking of the rectum and anal canal, here is the rectum right here, and we talked about the anatomy of the rectum, so we're not going to go specifically into what's inside the tube, but we do want to point out that there is the internal anal sphincter right here. Okay, so that's the one under involuntary control, and imagine that goes all the way around, so there's not just on either side, it goes all the way around the tube. And then we have our external anal sphincter, and technically there are three parts of that external anal sphincter, and remember they're skeletal muscles, so they're under voluntary control. You don't have to know deep, superficial, and subcutaneous parts of the external anal sphincter, because oftentimes these can't be separated out, so you often see them as just one particular entity. So know them as the external anal sphincter, not necessarily the parts. And they also will go all the way around the outside of the internal anal sphincter. All right, so to help you maintain conscious control of defecation. And then superiorly here, we see some of the muscles of the pelvic floor, of the levator ani, the iliococcygeus and the puborectalis up here, and where they lie specifically in relation to the internal anal sphincters and the external anal sphincters. All right, so taking that to another point of view, our external anal sphincters right here, our internal anal sphincter would be right here, and then surrounding all of that would be our levator ani muscles, as we saw in this picture over here. All of the organs and muscles within the pelvic cavity, the true pelvic cavity right here, are covered by what we call pelvic fascia. And not only does it cover the muscles and the organs within the pelvic cavity, but it also separates those organs from each other. So here we see a separation between the rectum and the uterus, and a separation between the uterus and the urinary bladder right here. And then of course if we look at the male over here, it's not showing all of the pelvic fascia up here, but what it is showing you is that septum, so where the separation occurs between the rectum and the prostate. So the peritoneal membrane would be a continuation of what was coming from the abdomen into the pelvic inlet, and covering the pelvic fascia that we went over in the previous slide. So you notice it covering same organs that we saw in the previous slide, and also providing a separation between those organs as well. And it tucks pretty nicely between the organs and forms different folds, such as the recto-uterine fold, the recto-uterine pouch. All right, so those are potential areas within the pelvic cavity that's formed by the peritoneum between different organs, and of course it's named according to the organs that it sits in between. Another example is right here. You have the rectovesical pouch, and remember vesicle is another name for the urinary bladder. So notice that that peritoneum sits over these, and it covers these organs, but the organs are not within the peritoneal membrane. So just like we talked about those retroperitoneal organs, like the kidneys would be an example, these organs, the uterus, the urinary bladder, the rectum, are also outside of the peritoneum. We can't call them retroperitoneal because they're not all behind on the posterior abdominal wall, but they are outside of the actual peritoneum. All right, so again, I'll apologize for the slide being off when it was imported. But again, you have access to the PowerPoint, so make sure you take your notes on there. So what we want to talk about here is the somatic nerves, the sacral and coccygeal plexus. All right, sacral and coccygeal plexus. So you would expect that the sacral and coccygeal plexus would come from the sacral nerves, S1, S2, S3, S4, and S5, as well as coccygeal. But notice that they also have some significant contributions from L4 and L5, the lumbar. And in a few lectures from now, we're going to talk about what we call the lumbosacral plexus. All right, so this is a preview to that, and you'll see it come up again later on. So notice that these are somatic nerves, so they will take part in not only sensation, allowing you to feel different things, but if they are somatic nerves, then they're also going to go to skeletal muscle, as opposed to sympathetic and parasympathetic, which would go to smooth muscle within organs. So getting a little more specific, our sacral plexus would go from L4 right here to S4, and then our coccygeal plexus would go from S4, include S5, as well as the coccygeal. And notice at the tip of that, we have our anococcygeal nerve. So the name tells you exactly what those are going to go to. Now notice over here that the pelvic splanchnic nerves, which are parasympathetic nerves, are also going to travel with the somatic nerves from S2 to S4. So you're going to see your pelvic splanchnic nerves, that which is from parasympathetic going to smooth muscle of the organs within the pelvic cavity, coming from S2 to S4. So we're not really going to take this apart, and I'm not going to expect you to know all the branches for this, but just to point out that, you know, in the lower sacral regions, that's what's going to go to our external anal sphincter muscles, as well as our levator ani muscles. The important one that I do want you to know is the pudendal nerve right here, which is coming from S4, as well as a branch from S2 and S3. And the pudendal nerve is going to run through the pelvic floor muscles and the perineal muscles, and remember, it ends up going to the external genitalia, and we talked about that when we covered the reproductive systems a few lectures ago. Another reason why this nerve is important is that it is often the site of a nerve block, a pudendal nerve block, which is given for childbirth as well as minor surgical procedures that involve the perineum. So it will numb that entire area, giving that pudendal nerve block. So finally, if you notice, all the smaller branches coming off of the sacral and coccygeal plexus are going to muscles that are within the pelvic cavity or within the pelvic region or the hips, such as the superior gluteal, inferior gluteal, and so on. But these bigger branches are what's going down to the rest of the leg, and we'll talk about that when we get into the lumbosacral plexus, because this big branch right here is going to be known as the sciatic nerve, and that's going to give rise to branches that supply nervous system innervation to the muscles and the skin of the lower leg, particularly the posterior compartment. So the previous slide, we talked about some autonomic nerves, in particular the parasympathetic nerves coming from the pelvic splanchnic nerves. But in this slide shows the sympathetic trunks. So the sympathetic trunks on either side of the body of the vertebrae, going down the central portion or the medial portion of the sacrum on the anterior side, and then providing branches that will become part of the splanchnic nerves that are going to the organs that they need to go to. So we also see now a more close-up view of the superior hypogastric plexus, and notice that it contains both descending sympathetic, so it's not just coming from the areas within the lumbar sympathetic trunks, but also from above, and then there are pelvic parasympathetics that are going up. So just another picture showing you the inferior hypogastric plexus and how they intersect and join the hypogastric nerve, the superior hypogastric plexus. And remember that all of these are going to be autonomic nerves, okay, as opposed to those that are coming out of the spinal cord, the sacrococcygeal plexus, which are going to be mostly somatic. All right, so the main takeaway here is to understand that this group that I am circling in blue right here would be somatic, whereas the group that I'm circling in red right here would be the autonomic. All right, and again, this picture is just showing you the pudendal nerve as it's coming off of S2, S3, S4, going through the muscles of the pelvic floor, the levator ani muscles, as well as supplying nerves and branching to areas of the levator ani muscle, as well as the external anal sphincter and external genitalia. All right, so you notice that it gives rise to the inferior rectal nerve, the dorsal nerve of the penis, just kind of showing you where the branch points are and what they are actually going to be going to. All right, so a little more detailed view of the pudendal nerve. So you'll see their origin right here on either side, and keep in mind that you do have a pudendal nerve on either side, and you see it directly going to the external anal sphincter, so again providing that control of fecal continence, going to the, of course this would be female because you have the vaginal opening here, going to muscles that are surrounding the vaginal canal as well as the urethra, and going to the erectile tissues in the female here, the clitoris, and in the male it would obviously be the penis. All right, so blood supply to the pelvic cavity comes from the internal iliac artery. All right, so here we have the common iliac artery. That's going to branch into the internal iliac artery and the external iliac artery. And the external iliac artery is going to go down and outside of the pelvic cavity and supply blood, and branch out and supply blood to the lower limbs. But it's this internal iliac artery which is going to branch into an anterior and posterior trunk and provide a blood supply to the organs and muscles of the pelvic cavity. And so one of the blood vessels that you should be familiar with is the superior gluteal artery. And notice that that is a branch coming off the posterior trunk, going between the lumbosacral trunk here and S1. All right, so that's where you'll find the superior gluteal artery going between the lumbosacral trunk and the S1. In fact, that's one of the ways that you can identify where the lumbosacral trunk ends and where S1, S2, and S3 begin, is if you see this major artery coming off the posterior trunk of the internal iliac artery going between two big nerves, then you know that that's got to be the superior gluteal artery, and then therefore this must be the lumbosacral trunk and the anterior branch of S1. And the superior gluteal artery is going to basically give a major contribution of blood supply to the muscles and skin of the gluteal region. And it's also going to give off branches that supply muscles and bones that make up the pelvic wall. So here we're going to focus on the anterior trunk of the internal iliac artery. So just for reference, here is our internal iliac artery. There is the posterior trunk, which we talked about in the previous slide. And here would be the anterior trunk. I'll do that in blue. Here would be the anterior trunk coming out here. And the anterior trunk is going to give rise to many branches, including the inferior gluteal artery. So remember, the posterior supplied the superior gluteal artery. The anterior is going to supply the inferior gluteal artery. So that's going to go the piriformis muscle right here, and it's going to supply blood to the gluteal region as well as the hip joint. And then we have our middle rectal artery, which of course is going to the rectum, and that's a branch of the anterior. And we'll also have our internal pudendal artery. Of course, that's going to supply many of the muscles and organs of the perineal region. All right, and then some other branches. Uterine artery, of course, I'd go to the uterus. Umbilical artery would go to the urinary bladder. Vaginal artery, of course, go to the vaginal canal. The obturator artery, which is named because it goes through the obturator foramen and will supply blood to the adductor region of the thigh. And the superior vesical artery, which of course we know, actually that's the uterus, will go to the bladder. Urinary bladder more specifically. And so in this picture right here, we get a little bit better view of the anterior trunk right here and where the branches are actually coming off, as opposed to this picture which showed the organs they're actually going to. And then here we have the perineal arteries, which are branches of the internal pudendal artery. And if you follow them along, you notice that they go to the area of the perineal membrane and eventually make branches that go to either the scrotal sac in males or to the labia majora in females. And if I didn't mention this before, you can kind of guess from the blood supply that what would have been the labia majora in females is the scrotum in males. So those are analogous structures to each other. The scrotal sac in males is analogous to the labia majora in females. And so, of course, that's where you would find in females that terminal branch of what would have been the gubernaculum. And if you remember, the gubernaculum is what allowed or helped the descent of testes into the scrotal sac. Generally speaking, the major veins will follow the same path that arteries follow into the internal iliac vein, and then of course that would go back to the inferior vena cava, then up back to the heart, with a few exceptions, one being the dorsal vein of the penis, or the deep dorsal vein of the penis rather, as well as the clitoris. They're going to go into a system, this prostatic plexus of veins. So they're going to go to this plexus that surrounds the prostate in males, or the urinary bladder in females. Looking at the veins near the rectum and anus, the veins that are draining the muscles that are surrounding the rectum and anus would go to the caval system, which means they're going to go directly to the inferior vena cava, or they would drain to tributaries that go to the hepatic portal system, and of course that's going to drain the distal rectum as well, which will go to the liver before it goes back to circulation. And so these areas that are different from what we talked about going to the internal iliac vein are part of what we call the portocaval system. And of course, perineal veins would drain the perineal region as well as the scrotum or labia majora, and join up with the internal pudendal vein, which then of course dumps back into the internal iliac vein. All right, I think we mentioned these before. Pelvic lymphatics are going to follow blood supplies as well and end up dumping into the thoracic duct, which will go back into the thoracic cavity and, of course, uh, put fluid back into the venous circulation. And along the way, there are these various lymph nodes that, of course, will be sentinels for anything that may get out of the organs of the pelvic cavity. So important to note that these are deep. You can't feel or palpate for any of these. So just be aware that they are there, and again, follow the circulatory pathway. Perineal lymphatics, the same thing. Remember that you have these lymph nodes near the testes or the labia majora that go medially or go along the inguinal ligament here, and you can palpate those, so those would be a good indicator of an infection or some kind of foreign matter that has gotten into the lymphatic circulation that your body is trying to fight off. All right, the perineal boundaries we've kind of already talked about. That consisted of the urogenital triangle as well as the anal triangle here. And so the borders, of course, would be the bones that make up the pubic symphysis, the ligaments between the ischium and the sacrum here, the coccyx posteriorly, and then superiorly, of course, the pelvic floor, which consists of the perineal membrane, deep perineal pouch, as well as the levator ani muscles and the external anal sphincter. Then, of course, inferior to that would be the skin and fascia that round out the area. Clinically, however, you'll find that the boundaries or the perineum is the area between the external genitalia and the anus. All right, so this region here where the perineal body would be located, or if the vagina weren't there, if this was a male, between the urethra or the scrotal sac and the anal aperture. All right, we talked about the perineal membrane and the deep perineal pouch, which is superior to this view that we're seeing here, which is an inferior view of the pelvis. But there is also a superficial perineal pouch that is between the perineal membrane and the skin. And within that superficial perineal pouch, you'll find several other muscles, which include the ischiocavernosus muscle. And that muscle helps move blood from the roots of the penis and the clitoris to the erectile tissues. All right, so blood is shunted towards the external erectile tissues. We have the bulbospongiosus muscle, which in women moves blood from the attached parts of the penis and clitoris. All right, so it's going to help out the ischiocavernosus muscle. And in men specifically, it's used to remove residual urine from the urethra after urination. So when the bladder's empty and you're squeezing the last few drops out, it's this bulbospongiosus muscle that's squeezing the urethra and allowing the last little bits of urine to come out. And it also is what is responsible for the pulsatile emission of semen during ejaculation, because ejaculation doesn't come in just one long stream, it comes in several spurts, and it's this bulbospongiosus muscle that's responsible for that. And then finally, we have the superficial transverse perineal muscle right here on the posterior border of the perineal membrane. And its job specifically is to stabilize the perineal body, because remember, this is an important structural component for muscles to attach to. So these muscles right here attached to the ischium on either side help to stabilize this perineal body. All right, so this picture is just showing you the male right here. Here's your ischiocavernosus. So it's over the roots, and again, it's going to help shunt blood into this direction. Here is your bulbal spongiosus muscle, so it makes a little more sense now that it would shunt blood this way towards the glans penis in males, as well as squeezing the urethra, the spongy urethra, for that pulsatile ejaculation phenomenon. And then the transverse, of course, the same function to stabilize that perineal body. All right, so this is kind of a little bit of surface anatomy, if you will. Here, what they're showing you is the urogenital triangle. All right, the urogenital triangle going from the pubic symphysis to the ischial tuberosities, and then a midline between them. So that would be the anterior part, the urogenital, and then the posterior part being the anal triangle, because it encircles the anus right here. And so anatomically, if you have a patient that is in a lithotomy position like this, you will get a general idea for where the pelvic inlet is located and where those structures are in relation to that. All right, so just another picture showing you the urogenital triangle anteriorly here, and the anal triangle posteriorly here. The urogenital triangle in red and the anal triangle in green. All right, and you can also see the borders here of the triangles. Notice that the superficial transverse perineal muscle right here kind of forms the posterior border of the urogenital triangle and the anterior border of the anal triangle. And so one more time, this is just showing you the same concept in the male. And of course, if you were to reflect the scrotal sac back this way along with the penis, you would see the area of skin between the scrotal sac and the anus, which would be clinically what would be referred to as the perineal region, as opposed to the triangles here, which kind of outline, again, the pelvic outlet. And instead of having a vagina there, you would see a bulge, which would be the bulb of the penis and the beginning of that spongy tissue, as well as the bulbospongiosus muscle. All right, and then just one final note about this. We know that the corpus spongiosum ends in the glans penis, and we talked about the prepuce. The prepuce, the other name for that is foreskin, covering the glans penis, and that's the normal state. That's how all males are born, and it's only through the process of circumcision where they cut off that prepuce so that the glans penis is not covered by the prepuce anymore.